Everyone, how are we doing today? I hope we are all doing fine. Okay, my name is Lami. You're welcome to my YouTube channel. This channel is all about personal growth, healthy and godly lifestyle. Please like, comment and share. If you're a returning subscriber, thank you. And if you're new here, please do well to subscribe to our channel. Today we are going to talk about a very important topic. We are talking about child health, talking from experience, and also I'm a certified community health extension worker, like controlling high fever in children. So from experience, I know that children do run temperature in the middle of the night. And what are the causes of fever in children? It might be due to malaria, typhoid, or any kind of infection, or teething. So why I'm making this video is because I know that so many new moms used to pass through a lot, because when they are running temperature, it comes with a lot of things. Some of them convulse, some of them will be shaking and be doing so many different kind of things that destabilizes the mother. So from experience now, I want to share. So when your child is running temperature, is having high fever in the night, what you're expected to do as a mother is not to be panicking, is to be stable. You are supposed to be stable enough in order to be able to provide solution and help your child that is running temperature. But by the time you get confused and you are not stable, you will not be able to render help. You will not be able to take care of your child. So what is expected of you is to be stable, and then look for a towel and a lukewarm water, a room temperature water. They run temperature, and some of them it even go high. It makes them to talk, it makes them to cry. So this motherhood is not easy, but you just have to sacrifice. Whenever they are not feeling well, just know that okay, I have to sacrifice. It's not the sleeping time. It's not a sleeping time for me. It's time to help my child overcome this sickness. So you are going to monitor them, and then the next morning you are expected to go to the hospital and run tests to find out what is wrong with your child. So after you go to the hospital, you run tests. When you run tests, then you treat your child appropriately. Desist from drug abuse, like desist from giving your child medications by yourself. Just try by all means, go to the hospital, find out what is wrong with the child, and then treat it. But like in teething, high temperature is like a normal thing. They do run temperature, they do have fevers when they are teething. So you use your towel, clean towel, and then soak it in the lukewarm water, then squeeze out the water, then you mop your child's body. And it's good that you start from the feet, then you mop it down to the head. You just keep mopping him and make sure that the temperature drops down. Like you will see that the body gets cool, it comes back to its normal temperature because of the water that you use. Even in adults, you don't just go because somebody is running temperature, you just go immediately and start administering medication. It's important that you tell the person to go and bath so that the temperature will come down. So it's the same thing with your child. You make sure that you tap it, sponge the child, you mop the child's body to bring the temperature down. Then before you administer paracetamol. When you administer paracetamol, then you wait till morning. Then you take your child to the hospital to go and run tests. When you run tests, your child will be treated appropriately. The child will be diagnosed and treated appropriately, and then your child will be over. Even in adults, it's good that you treat yourself, like your health. Take your health seriously. Whenever you see that you're not feeling well, make sure you treat yourself and make sure you're okay, because it's not good to leave an untreated cases. So thank you so much for watching. God bless you. I love you. Bye.